I'm an OHSU patient, and they sent all their patients an email over the weekend with this subject line: OHSU calls for urgent action as hospitals fill with COVID patients. The healthcare system cited its latest very grim COVID-19 forecast. It predicts Oregon will be short 400 to 500 hospital beds. Let that sink in. By Labor Day in just a few weeks, if we don't stop the virus from spreading right now. That means all types of patients wouldn't be able to get treated in the hospital. I talked to OHSU about why they sent out that letter.
It is so sad because it's 100% preventable.
Most people don't see what Jamie Pinney sees every day in OHSU's COVID ICU.
So we're seeing way younger patients, some with no pre-existing conditions.
Stressed healthcare systems now dealing with a rapid uptick in COVID-19 patients. The way things are going, it's only going to get worse.
It is bad.
Data shows Oregon will be short hundreds of staffed hospital beds in 3 weeks.
The rapid increase of who needs my skill set as an intensivist is unheard of. We haven't seen that.
Right now, OHSU is at full capacity based on staffing abilities.
We are not able to provide a bed assignment in the time we wish we could and what we were able before COVID.
As of Monday, 30 people were hospitalized with COVID at OHSU, and COVID patients make up 25% of ICU patients.
It's not normal to have one disease take care of a quarter of your patient population in an ICU.
OHSU says 100% of COVID patients in its ICUs are unvaccinated.
I'm really tired, but all of my colleagues are tired.
Those on the front lines are burned out, breaking down in the hallways and quitting.
Like, I personally started having panic attacks, and I'm doing my best to keep it together for my children at home.
What does this mean for you and your family? If you need to go to the hospital for any reason, you may not get a bed. To be clear, that's everyone, not just COVID patients. To make room, OHSU has to delay many types of surgeries, many of which were put on hold this past year.
Anything which is emergent and life-saving right now, we continue to provide that service. We will continue to do our best, but we need your help.
There are things we can do right now to help. Wear a mask inside and outside if you can't keep your distance. Limit get-togethers and get vaccinated.
Absolutely the best defense strategy we have. We can only control now and the future, so do it now.
All we're trying to do is save people. That's all I'm doing by doing this interview, is trying to save people.
If you're not vaccinated, healthcare workers ask you to stay home and avoid being around people. They're also asking everyone hold off on risky activities that could send you to the hospital or the ER. Oregon, by the way, is in a tough spot compared to the rest of the country. OHSU said last week we have the fewest number of available hospital beds per capita in the country.